Hello, my name is Michelle Morand, and this fellow in the picture here is Alexander Rowland, the founder, along with me, of Cancer Treatment Options and Management. He is the leading precision cancer medicine research expert, and we are very pleased and proud to have him on our team. Our team is made up of cancer research specialists and MDs, as well as nurses and advocates. We're not a treatment facility. What we are, you can think of us as the middleman between the most current science-based medicine and your medical oncologist, helping to bring them better information and a more accurate and effective treatment plan that they can prescribe and provide for you. We have 25 years plus experience in cancer care, and specifically in the use of genetics to inform patient care, what treatments are going to be best for a patient and how well those treatments are working. That's essentially the focus of oncogenomics, using genetic testing to identify these things. We've identified for thousands of patients over the 14 years that we have been providing this service, far enhanced treatment options that their medical oncologists, again, were able to provide for them, meaning the patients didn't have to travel and they didn't have to pay out of pocket for care. That's a big deal when you're dealing with cancer. The last thing you want to be doing is leaving the comfort of your home and having to pay for treatment if you don't have to. And we have a 98% success rate, actually, as a team over the past 14 years of helping your medical oncologist access better treatment options than they're currently providing for you or offering to provide for you, with their assistance without you having to travel, and with coverage from your standard of care system or insurance providers. We've provided treatment plans for patients of the Mayo Clinic, MD Anderson, Johns Hopkins, BC Cancer Agency, Mount Sinai, Princess Margaret, Tom Baker, Cross Cancer, every cancer agency you can think of, really. And we have helped many cancer patients get better care than they otherwise would have been provided. The other positive, I think, for every patient we assist, we are educating their medical oncologist on the newest and best treatments and diagnostics that are available. And in this way, we're not only helping each individual patient, we are helping to expedite the uptake of this new science-based medical approach to cancer treatment. You're here probably because you're either a cancer patient or an advocate for a cancer patient, and you're not sure if you're actually getting the best cancer treatment. It's hard to tell. It's such a quagmire out there. If you just Google best cancer treatment for whatever type of cancer you or your loved one has been diagnosed with, there's going to be 10 YouTube channels telling you not to do this thing that your doctor's telling you to do, and 10 telling you if you don't, you're in big trouble. There's going to be mounds of alternative therapies recommended for you, lots of information coming your way. Of course, you want to be making the most educated decisions. Of course, you don't want to be foolish and miss out on opportunities, but that requires you having a team of experts who are not biased, who are well educated on the most current science-based options for care, so that you can have confidence in every decision you're making. And most importantly, so can your medical oncologist. It's well known that cancer treatment in standard care around the world is not keeping up with the most current science. It's not about your doctor. It's not about their education or willingness or interest to help you. It's just the facts of essentially the size of medical systems, the bureaucracy associated with medical systems, and frankly, just funding, and how long it takes from something that is now a proven FDA, which is the gold standard around the world, treatment, to trickle into your specific cancer agency and your medical oncologist understanding when, if it's right for you, and how and when to prescribe and administer it. There can be 10-year gaps between the time something is developed and proven to have efficacy for people with your unique features and the time your doctor not just hears about it, but has confidence in their ability to prescribe it for you and access it for you. Our whole reason for existing is to shorten that gap so that as soon as something has proven efficacy for the unique features of your cancer, you're going to be able to get access to it, not 10 years down the road, long after you really need it. The problem is not that there aren't better treatments available. There are hundreds of targeted therapies that are FDA approved. If you're not sure what that means, a targeted therapy is a type of therapy that is based on genetics, oncogenomics, which is the evolution of cancer care. It's our new understanding as a scientific community that cancer is a disease of the genes. You can't have cancer if you don't have genetic mutations that caused it. You may not know that until now, but that's a fact. If you have cancer or someone you love has cancer, it means that certain genetic mutations have occurred for them. They may have been born with some, but for the most part, most people, those mutations develop over the span of our life due to environmental toxins, lifestyle choices, lots of stuff that's not in our control but does affect us. And these mutations kind of come together and they add up to create this perfect storm. And that's what creates cancer or triggers these cells to constantly replicate themselves and prevents the immune system from killing them like it normally would. That's the perfect storm of cancer. And that's how tumors start to form. And that's when the problem is really a problem. So in this case with cancer, pharmaceutical companies have known for decades that genetics is key. And so for decades, they have been designing treatments called targeted therapies. Immune therapy is a type of targeted therapy you may have heard about. And these targeted therapies are designed to target a specific mutation. They might target the mutation and kill the cell with that mutation, or they might target the cell that has that mutation and do something to disable it or to enhance it so it can function again. It depends on what's going on in your body and what it is, again, that has happened to mutate those cells and what's driving your cancer. So we know cancer is a disease of the genes. We have developed hundreds of targeted therapies to target the most virulent and well-known mutations that occur with cancer. But these tests are not part of standard care as a rule. At most, people might get tested for, 5 to 10, maybe 20 genes. Proper genetic testing for cancer has two key elements. We look at DNA, and we can look at the most popular and effective tests right now, look at over 550 known cancer-related mutations. So if your doctor's testing you for 10 or 15, there's quite a variance between 10 and 15 and 550. If you've been told that you already had genetic testing and you didn't have any markers, I want you to take a nice deep breath, and I want you to know that there is, that's not possible. You can't have cancer without having genetic mutations, and there are far better tests that you can have that will find out what the drivers of your cancer are, and then you can be matched to the proper targeted therapies. Targeted therapies provide cancer patients with far more effective treatment, far fewer side effects, and that's really what it's all about when we're dealing with cancer. This gap between what medical science is currently capable of providing versus what public health care commonly offers, regardless of what country you're living in. Barriers exist for patients to access the most effective treatments. And we're here to help shorten that time span and make sure that everything that your doctor needs to be able to provide you with the most effective treatment is presented to them. All the advocacy that needs to be done is provided so that it doesn't take them any more time to give you better care. And that's really important because your doctor is super busy, doesn't have a lot of time, as you almost certainly already know, and still you deserve better treatment. So how do we do that? With our approach to cancer care, precision cancer medicine, and personalized research, we can improve the accuracy of your diagnosis significantly. Standard care diagnostics provide you with about 60% accuracy, things like CT and MRI, for example, versus more effective for cancer imaging tests like PET-CT. And again, standard pathology does not provide you with proper genetic screening. It essentially just looks at a few variables. Is it benign? Is it malignant? And a couple of other variables variables that might help your doctor, again, understand which type of chemotherapy to offer you, but not which type of targeted therapy or immune therapy, or which combinations of therapy are really going to provide you with the most benefit. For that, you require genetic testing, which is 99% plus accurate. Our team will get you the most up-to-date science-based treatments, the ones that are absolutely going to provide you with the most benefit based on the unique genetic features of your cancer and other factors to do with your health. Are you missing a kidney? Do you have other immunocompromised concerns? These things need to be factored in when you are looking at treatment options, and our team of researchers and MDs will ensure that those factors are taken into consideration. Our team can help you avoid the long wait times. It can help you avoid the process of chemotherapy, whether you have to get chemotherapy. For the most part, when proper genetic testing is done, chemotherapy is not indicated as the best treatment for you. It may not be on the list at all, let alone not at the top. We will, as mentioned, assist your doctors in providing the best care for you, and we help your doctors access treatment through the public healthcare system, as mentioned, or with your insurance provider. The key really is being able to get the most accurate diagnostics so that you can prove what treatment you need, and that is our area of expertise. I'm going to tell you a little bit about how we do this. First, I want to tell you a little bit about why what we do works so well. The most effective approach to treating cancer, what is considered to be the evolution of cancer treatment, is also known as oncogenomics, or precision cancer medicine, or precision oncology. See, this approach to cancer treatment is so new, we don't even have a firm name for it yet, but you may have heard it called any of those things. What we're really talking about here is the use of thorough genetic testing and a proper personalized analysis to identify what treatments are going to be most effective for you. Not just the average person with breast cancer or colon cancer or prostate cancer or glioblastoma or whatever it happens to be that you're dealing with, but you, the unique genetic features that have caused that perfect storm that caused cancer for you. We have to figure out the answer to that. What is that? What was that perfect storm? What are those primary drivers of your cancer? And what treatments exist out there to target those drivers, and how can you get access to them? This information, this oncogenomics and this genetic testing provides us with such clarity, again, 99+% confidence about what it is that you need in order to effectively beat cancer. The thing is, as I hinted at before, these diagnostic tools that are far more accurate than common standard of care diagnostics, and you need these in order to properly match you and the unique features of your cancer to the most effective treatments that are available right now. And again, even to kind of prove to your medical oncologist or your insurance provider that this is the right treatment for you, you must have these diagnostics, and yet they're not yet a part of standard of care. As I mentioned earlier, you might be offered a small panel, maybe even a panel that looks at 125 genes. But as I mentioned before, we can look at 550 genes with DNA and 20,813. That's almost 21,000 genes with RNA testing. Our team likes to use both, but that's where we come in, making sure that you get the most accurate diagnosis, the most effective treatment. So the first thing to do is the crystal clear diagnosis. And that's where, as I've mentioned, we would conduct based on your needs, your unique case, what's already been done for you, the treatments you've already had, what stage you're at, other key factors specific to you. We would identify which genetic test would be most effective for you, and then we would coordinate those for you. For the most part, all that's required is for you to sign a simple release form for us to do everything we need to do. Rarely do you need to engage in any sort of surgery or further procedure than you would already have in order to get your diagnosis of cancer, and we can take care of everything else for you. So ideally, we're going to conduct this research for you, and then once we receive these results, our team starts working its magic to figure out, okay, based on the unique features genetically of your cancer, what are the treatments out there that are going to be more beneficial for you? Corey's a fabulous example of precision cancer medicine and of what Alex and his team can provide for somebody. He came to us numerous years ago with stage 4 neuroendocrine cancer, a very complex case, not common at all. His doctors at his local cancer agency essentially had told him that they had no options to offer him, and he needed to get his affairs in order. He was a young fellow. He was husband, father of 2 small children. He was not ready to just accept this. And so he contacted us. We conducted genetic testing for him. We advocated with his medical oncologist. He's in Canada, by the way, in Alberta. And we advocated with those oncologists who, remember, had told him there was nothing more they could do. They even told him when he asked about genetic testing not to bother, that it wouldn't provide him with any information that he didn't already have and wouldn't provide him with any more treatment options. Fortunately, he didn't listen to them because when we ran genetic testing for him, we found actually some excellent treatment options for him. We were able to advocate with his medical oncologist to overcome their objections and help him get the treatment that he needed. And within 1 year, his cancer was gone, and he was able to have surgery that he required. And this is years ago now. He's actually been a case study, and he was just this last year featured as a speaker at the neuroendocrine conference for medical oncologists. So that's how unique his case was and how amazed his doctors were with his results. But his case is not unique, even if his type of cancer was. When you apply precision cancer medicine, it's very reasonable to expect a far better outcome than you're being told to expect from standard of care. What I just mentioned that we do or did for Corey with the testing, the research, the advocacy, the access to the treatment, all of the things, these are the things that we would do for you. We're in your corner from start to finish, and we want to do everything we can. We'll take everything we can off your plate. We know you have a lot to deal with, and we just want to take care of everything we possibly can for you. You have the biggest job. You have to show up for treatment, and you have to just keep taking good care of yourself. That's what matters here. Let us do everything else. As I've mentioned, what we do after the genetic testing, so step 1 is make sure you get the most accurate diagnosis possible. That's what matters. How can we solve a problem if we don't fully understand what it is? And how can your doctor have confidence in what treatments to offer you if you can't provide the evidence of what it is that you need most? And that's where that thorough diagnosis with the genetic testing comes in. Once we get the genetic testing data, it's not enough. What is produced from those tests gives us a starting point of what we need to look into for you, what the probable drivers of your cancer are. But personalized research is required to make sure that the unique features of your case, as I said, maybe you're missing a kidney, maybe you have some sort of immunocompromised thing or some other health concern that might affect your doctor's comfort in prescribing you certain treatments or how you might respond to treatments. Maybe what we discovered in your genetic testing is there are a couple of mutations that you have that are kind of holding each other in check. And so they have to be targeted simultaneously for the most effective outcome. This is where the personalized research really comes into play. And this is where Alex and his team, I think, really shine in the numerous hours that they take reviewing your genetic testing results, reviewing your personalized case, using the most current, again, medical science and FDA approved research to identify the treatments that are going to be most effective for you. I like to think of us as kind of creating a breadcrumb trail from these diagnostics to the treatment for your medical oncologist. So again, this very busy person who wants to help you, but doesn't have access to these things and doesn't have the time to look into it themselves, can have confidence in the data that's being provided them, and they can provide you with a prescription for the care that's going to benefit you most. So this is where the personalized research and treatment plan is so important. Being able to show your doctor why these treatments are going to benefit you better and how they can easily access them for you. If you'd like our help with this, you'd like us to do this all for you or help work with you to advocate or teach you how to advocate for yourself, we're happy to do it all for you. We're happy to just be tapped in to consult with you as you need and guide you. whatever it is that you want, fill out the application below, and then we can have one of these free strategy sessions. That's a half-hour chat with myself where we'll talk about your case specifically and how precision oncogenomics could benefit you. I want to tell you a little bit about Annette. She's really, it's such a lovely story. Again, we have numerous of these stories every month, but Annette is really precious to me because we worked with her early on in our service. She was a young mom. By the time her cancer was diagnosed, it was stage 4. Her oncologist, who really wanted to pull out all the stops for her, had tried a few of the standard care approaches with no benefit whatsoever, and had told Annette, just as Corey heard, that she needed to get her affairs in order. She had 2 young children, a loving husband, so much to live for. She wasn't okay with that. Her husband actually worked in the scientific field, and through a friend, he heard about us and reached out. We conducted some genetic testing for Annette, and we identified that she was going to be a prime candidate for what at that time, we're talking like almost 10 years ago now, was very new and hadn't even been in Canada yet, a specific type of immune therapy. Pretty much everybody's heard of immune therapy now, but at that time, no. And so we coordinated with Annette's oncologist to get her access to this new type of treatment that our testing indicated would really just knock it out of the park for her and give her a really beneficial response. We expected it to be curative, but of course, again, in medical, we don't say 100%, but we knew it was really going to benefit her. Her doctor was on board, but again, needed to tick the boxes and make sure that this was going to be really beneficial. So we had to do our work, provide all the evidence, which we did. Her doctor was willing to prescribe this treatment, and within about 6 months, Annette was declared cancer-free. I checked in with her about a year ago, just wanted to see how she was doing, still doing incredibly well, loving life. And one of the things that she said to me that touched me so very much was that one of the things that she most wanted when she got her cancer diagnosis was just to be able to see her kids graduate. And she had just watched her youngest child graduate, and she's in perfect health, no evidence of cancer. So I was pretty happy to hear that. That's like a dream come true for every cancer patient I know, but Annette is definitely living the dream. And that again wouldn't have been possible without Alex and his team, and specifically precision cancer medicine, the genetic testing linked to the most current and effective treatment. I guess one of the lovely little side stories of Annette's story, aside from how wonderful it is that she's still here and in great health, is Alex and his team were the very first to bring this treatment to Canada. And their advocacy with that particular doctor, this is in BC, helped BC Cancer better appreciate the value of this treatment and expedited the uptake of this treatment for other cancer patients. And that again is our side mission here. We're here to help you right now with what you need, but our side mission is to make sure that everybody gets this ASAP. And we're thrilled that immune therapy became something that became far more utilized and provided to cancer patients in Canada, in part because of Alex and his team and their advocacy for Annette and the success of her case. Step 3. So we've got our diagnostics, we've got our personalized research and treatment plan, and then we've got our advocacy and just ongoing research and monitoring for you. We want to make sure that not only do you get the best treatment now, if your cancer comes back, you know immediately what you need. Ideally, we catch it really fast before solid tumors have even had a chance to form. And we have unique blood-based testing that we provide our clients to ensure that we're staying on top of their cancer care. This means we know when your cancer is gone, so you don't get unnecessary treatments. We know as soon as your cancer is starting to recur, even before solid tumors have formed, so you can get treatment right away before there's any metastases or before there's any bigger concern. And that means A, it's more effective, and B, you need less treatment. We're always going to stay on the case once you're a patient of ours and make sure that not only right now does your doctor have all the support and information they need to provide you with the best care, and that you get the best treatment as quickly as possible, but that you always know what treatment you need and you're always on the best possible treatment. It might also benefit you to know we are not affiliated with any specific testing service or hospital or doctors or pharmaceutical company. We are not obligated to recommend anyone or anything. You are our primary concern, making sure that what you are getting in the form of treatment is going to be most beneficial for the driving factors of your cancer and the unique features of your cancer. That's all we're about. We take no kickbacks. We get no payment from any other industry or service provider. We work for you. I want to tell you about a few other patients just recently. Again, these are stories that we have numerous of these every month. Recently, we had a patient named Sheila. Her husband actually found us. She was a bit reluctant to question her doctor. She was a bit reluctant to do anything outside of standard of care, but her husband just didn't feel that she was getting the best treatment. And so he found us and he asked us to conduct our research and advocacy program for Sheila. We were able to identify for her a new treatment that had just maybe 2 weeks before been FDA approved. And something that you might not know if you're watching from Canada or other countries is because FDA is the gold standard for cancer research around the world. Most countries have a special caveat to allow their medical oncologists to prescribe FDA-approved therapies, even if they're not yet approved fully in their country. So, for example, in Canada, where this service originated and where I live and where I'm from, medical oncologists in Canada can prescribe FDA-approved therapies for their patients, even if they are not yet Health Canada approved officially, as long as there's proven efficacy for you. So that's why I talk about FDA approvals, because pretty much regardless of where you live, if something is FDA approved, you know that it's got good science behind it. You know it's not experimental. You know we're not wondering if it's going to work for you. And that's why your medical oncologist could prescribe it for you. So with Sheila, we found through the research that a stage 3 ER-positive breast cancer was her specific case, but the unique genetics of her cancer indicated a particular type of treatment, which again, just a few weeks before had been FDA approved for her type of cancer. So we had to do a little bit of advocacy with her medical oncologist. This is again a British Columbia, Canada patient, because it was so new, they hadn't even heard of it. They didn't even know it was a thing, let alone that they could access it for her. But we provided her oncologist with all of the paperwork and data that she needed, and that oncologist prescribed the drug for Sheila, and within a couple of months on Sheila's last scan, she was cancer-free. Her husband is of course ecstatic and just wants everybody to know about it, and as you see, he's telling people left, right, and center. He's a healthcare practitioner himself, so he works with patients a lot, and we're just thrilled for Sheila. Frederick is also somebody that I'm very thrilled came across our path. He had a precision second opinion. That's a 1-hour consult with our team where we look at your medical records prior to, do a little personalized research prior to meeting with you, and then hop on a Zoom with you and talk about what we've discussed, what we've discovered rather, and what's going to benefit you most. In the vast majority of our precision second opinions, we're able to provide numerous treatment options. This, I mean, like without you having to do any more testing, we're able to provide some recommendations that your medical oncologist can follow to enhance your current standard of care treatment plan. And that's what we did for Frederick. We were able to identify, because of some testing that he had already had, certain mutations that would indicate certain treatments being beneficial for him. And so we were able to work with his oncologist to get him access to one of these beneficial treatments. And he had an incredibly positive response, as we expected. This isn't guesswork. That's the whole exciting thing. We're not trying this to see if it works, which is what chemo kind of is for the most part. We're not hoping for the best. We're using the most accurate diagnostics to dial in the treatment for you. So we're not experimenting with you. We know these treatments are going to provide benefit for you. And then, as mentioned before, we're standing by to add the next one if and as needed. In cases like Corey's and Annette's, you know, they have long-standing recovery, and we haven't yet had to go back to the well for new treatments. Sheila, it's too early to tell, but we expect her to have a very long for sure. And Frederick, we're very excited for him as well. Point is, these cases are not unique. There's nothing magical about them. Really, there isn't. And as you see, numerous of these people came to us fairly late stage 3, stage 4, as most of our patients do, partly because people are hopeful that standard of care will work. Or as I was saying earlier, it's very confusing to try to figure out what to do. And so a lot of patients just default to listening to their medical oncologist. And again, your medical oncologist is knowledgeable. They are a specialist in the drugs that they know about and have already provided to patients, but they are not genetic specialists. They're not research specialists, and they don't have the time to do this type of research and find the proper treatment for you. How we will help you. Step 1, we will conduct the most thorough and accurate diagnostic process possible in cancer care today, using science-based medical diagnostics that your doctor will respect. Again, I care about you. It's you that I want to see do well, but we need your doctor to be on board. And that's what our team are experts at, connecting the dots, providing the breadcrumb trail, and really providing your doctor with all of the evidence they need so that they can have confidence that what we're providing in the way of suggestions really is the right thing for you. The personalized research and design, the treatment plan, the making sense of the genetic testing information that we found, bringing in all of the unique factors of you, your life experience. This is where we would also talk about nutraceuticals, supplements, diet, lifestyle changes. There's so much excellent research right now because this genetic thing has been a thing for 20 plus years now. There's so much excellent research about which supplements actually have proven efficacy to benefit cancer patients, or which alternative or naturopathic therapies have proven efficacy and which don't, which genetic predispositions are going to respond better to certain of these therapies and which should not be taking them at all. All of this information you need to know about, because there's so much that you can be doing from a lifestyle and diet and personal choice perspective to enhance the outcome of your cancer care. And that's part of your personalized research and treatment plan, is for us to figure that out for you as well, and then make sure that you know all you need to know about that and can action on it. And of course, the lifelong success. So making sure you get the treatment that we identified for you, advocating with your doctor, and then staying on the case, monitoring you with the most advanced blood-based testing that looks at almost every gene in your body to see how well your treatment is working, when your cancer is gone, if it's recurring, what genes are driving it then. If you've done any research into genetics and cancer treatment, you heard of this thing called emerging mutations. That's when your cancer treatment may have been effective initially, but certain mutations are now taking more prevalence. They've become the drivers, in essence, of the bus of your cancer in a way they weren't before. And so your previous treatment won't work as well in that case. In those cases, a lot of times doctors just assume, oh, I'm sorry, this isn't working for you. There's nothing more we can do. And in reality, there's lots more we can do. We just need to do some testing to find out what is now the driver of your cancer. And we can do that with blood-based testing. Just send a nurse to your home, take a couple of vials of blood, and in a couple of weeks, we know exactly what's driving your cancer. And then we circle back around and advocate with your doctor for the treatment you need most now. We will always stay on the case for you. As a client of ours, we are always going to be keeping you in mind. And as our team is pouring through the most current data, tens of thousands of new research studies in cancer care are released every year. It's a massive amount of data, and our research team is constantly pouring through it. And if we come across anything that seems to indicate that a treatment that is new or something that might have been around for a while but is now proven to have efficacy for the unique features of your cancer, we're going to tell you about it. You're not going to have to ask us. We're going to let you know there's something newer and something better, and we're always going to be keeping an eye on things for you. So if what you're looking for is a crystal clear plan of action for your cancer, where you get the most accurate diagnosis, where you get the most personalized treatment plan and guaranteed implementation, we will help advocate for you to access the treatment you most need, and we won't stop until you get it. That's what we do, and that's what we're here to provide. The free strategy session that I offer really is meant to make sure that you understand precision cancer medicine, you understand the benefits that it can provide, and that you you are a fit for our team, that the unique features of your case really will benefit from precision cancer medicine. So we offer this free introductory consultation. You can fill out the form below. We're going to get a fair amount of information from you right up front, because I want to make sure that the information I'm giving you is as personalized to you as possible. So please fill out the intake form as thoroughly as you want. Feel free to also follow up with an email with more information, and that way I'm just as well educated as possible about what's already been done for you, where things are at, and what you need, and we can make the most out of the time that we're going to have together. Just to recap, when you're supported by Cancer Treatment Options and Management, Alex and his team, myself and my advocacy team, you get first and foremost a free, no obligation, no pressure cancer care strategy call, that where we talk about what can be done and what that would look like for you. We're going to give you a new perspective that's just going to enhance your chances significantly of beating cancer, just like Corey and Annette and Sheila and Frederick and so many others. We're going to help ensure that you get access to the most accurate diagnostics. We're going to make sure that we put our global network of researchers and service providers to work for you. We're going to find the most effective treatments for you. We're going to make sure that you get the most beneficial therapy that science-based medicine can provide today. And we're going to advocate with your oncologist to help them access it for you. And 98% of the time, we're able to accomplish that with your current oncologist without you having to pay out of pocket for treatment, even if your oncologist has said there's nothing more they can do for you or no more options they have to provide than chemotherapy. Most of the time, cancer patients are just not on the right treatment, or they've just waited really too long to get started. We want to make sure that's not the case for you. You may very well be on the wrong treatment right now, or at least not the most effective treatment. That's almost a given if you're not engaging in personalized oncogenomics to inform your treatment. But even patients who are late stage 4, there's still so much that can be done, really. Our team does only have so many hours in the day. We do have limited availability. So if this video is playing for you, or the option to sign up for a free strategy session is being presented to you, it means we do have a few free spots. I encourage you to book in, have a chat with me, and let's find out what's going to be best for you and how you can get access to it as quickly as possible. As mentioned, if this video is playing and you are seeing it, there are spots available to meet with me, and we have a few spots for Alex and his team to take on new genetic testing and personalized research patients. So click the link below, fill out the intake form, and let's make sure that we find out what's going to be best for you, and that we do everything we possibly can to help you access it as quickly as possible. That is what we are here for. Every step of the way, we will do our very best for you. So fill out the application. I think I've said that a few times, and that'll take you to a link to book in a time to speak with me. And once you book in a time, there'll be a link to a video that's just going to tell you a little bit more about precision cancer medicine and a few other things, so that you know a little bit more about what we're going to be talking about, and that's going to help you get the most out of the time we spend together. Our motto is knowledge is power. It is my intention to make sure you are exceptionally knowledgeable about your cancer care and everything that can be done, because that is when you will be the most empowered and you will absolutely get the best possible treatment. I look forward to meeting with you very much. My team will do everything we can to help.